Hold on. Michelle, I got to send out another link to one of my speakers.
Okay. If you'll all direct your attention to the chat box right now while we're waiting, there's a message there from Thurston Bilal, who's a fantastic herbalist. Some good information there. So I would take a moment to look at that if you can in the chat box. Thank you so much, Mr. Bilal, for that.
Absolutely. I'm having a little issue adding the rest of the chat, so I will be adding some more things to that. I've come up with some lists of some things that people can do in case they have some of the symptoms from COVID or pre-existing conditions. Even if they don't have money, there's some things that I know that can help.
Can you just add those to the chat box?
That is exactly what I'm doing, but it's kind of slow in accepting them. I don't know what's going on. I added some and it didn't let me add everything that I wanted to add. So I will be adding it forthwith.
Very good. Thank you so much.
Randy, I just sent it. Come with me down. Yeah, something. Okay. Okay.
The electric cell nutrition cleanse. That sounds amazing. Like
Okay.
that made me feel good just reading that.
I think we're ready.
You think we're ready? Okay, well, we're ready to begin. Again, I've gone over the meeting norms, but one that stands out is to be sure that if your name and likeness is not something you want shown here, that you should go ahead and cover up your video. And Dr. Randall, the distinguished Dr. Randall Maxey will be our facilitator, and he will introduce our guest. Thank you, everybody, for your participation. Dr. Maxey, I hand it over to you.
Good afternoon, everyone. Welcome back. I've had a few thoughts that I'd like to convey to you. And for those of us who are parents, grandparents, aunts, uncles, brothers, and sisters, if someone came into your home and was armed and potentially threatening your family, whether they were joking or not joking, but playing with a loaded firearm, what action would you think about taking? And I thought about that. I saw a video of a lady in Orange County who went into a grocery store and she took off her mask while she was shopping. And someone told her to put her mask on, and she basically went off, hollering and screaming and spewing things into the atmosphere, basically putting all those employees and other shoppers at risk for COVID. There are others who just don't believe that the COVID-19 pandemic is real. They think it's political. And they're not all necessarily stupid people, but definitely ignorant. There's a colleague of mine who has 2 master's degrees. She's a registered dietitian. And she thinks it's a left-wing plot to get rid of the president of the United States and the Republicans. So she only wears a mask for political reasons when she's out, but she doesn't believe the COVID-19 is true. I have talked to physicians all over the country, the world, in fact. And I don't believe in South Africa and Ghana and other places like that, in Europe, China, that they give a kitty what the Republicans and Democrats do in the United States, but they have people who are dying from this pandemic. As a physician, I know people who have succumbed to the disease or ill from the disease, and it has nothing to do with politics. So I'm thinking if somebody came into my home and into my family with the potential of injuring someone, maybe they don't have a gun, but if they're not wearing a mask, if they've been exposed, if they haven't been tested, they are a threat to my loved ones, and I would have to treat them accordingly. This has boiled down to a life and death struggle. Now, we're not necessarily political on this call, but it appears that certain parts of our society are indifferent or negligent, or maybe even purposeful, that not only are people in general dying, but specifically there tends to be a higher susceptibility to people of color. And it's not just that we have comorbidities. It's that we do the jobs that I call the tip of the spear, where it is difficult to avoid contamination. So we have to adopt, in my opinion, a way to look at this as being purposeful, that we have to protect ourselves and the ones we love. To be clear, we must still wear masks. I heard a figure today on TV that if people were to wear masks, that would cut our infection rate by 50% by October. That's a few months from now. We know that there's an extra epidemic going on in Houston, Texas, in Florida. There are increased cases in California. Almost every state except two, one is Connecticut, somebody else will have to tell me the other, that this pandemic is not over and the numbers are not going down. So I urge you to protect yourself. Now, we tend to talk on this call about acute problems with healthcare, but we also know that there are other issues that will be here long after the active disease of COVID-19 may have quieted down. Those are economic issues. They are issues of healthcare disparities in general. They're the issues of food sources and food distribution, housing, psychiatric issues, negligence, domestic violence, substance abuse, and we as a community will have to address those. So I would urge you to listen carefully to our speakers. Today, our speakers include Dr. Randy Hawkins, who's a noted lung specialist. We call them pulmonologists. Dr. Hawkins is also on the California Board of Medical Quality Assurance. they control our licenses and the quality of our medical practice. And he's a distinguished member of our Los Angeles Community of Physicians. There is also Dr. Ann Stavern, who is a noted pediatrician and an immunologist and allergist. And we know that we have concerns about our children and sending them back to schools and daycare. And I always give a shout out to her that my two youngest kids are alive and healthy because she was their physician, Alex and Randy. We also have Dr. William Faulkner, who is a doctor of dental surgery, who is the president of the Angel City Dental Society. And we do know that the portal of entry of this COVID is in the oral pharynx, and that there are concerns about that we have not addressed. And we also have a number of other physicians on the call, including Dr. Ron Bailey, Dr. Tyler, and there are others who will make themselves known to me. We also have, and I just noted, Drs. Hal and Betty Walker from Cape Town, South Africa. And we're going to start our call. At least two of our speakers have time constraints, so we're going to maybe go a little bit out of order, and I'm going to ask them to speak for 5 to 7 minutes, and we'll hold questions until all the speakers have finished. That way we can get maximum time conservation. I'm going to ask Dr. Randy Hawkins. I'm going to ask Dr. Faulkner to speak first, and then we'll go from there. Dr. William Faulkner, whose son actually went to kindergarten with my son almost 32 years ago. Dr. Faulkner.
I'm not seeing Dr. Faulkner, Dr. Maxey. Looking for, is iPad 5, Dr. Faulkner? Is that you?
Okay, Dr.
Yes,
Faulkner.
Okay, excellent. There he is.
Reason or the other, I'm being identified as iPad 5. I don't know why that is. I asked my son to fix that, but I think he's probably still in kindergarten with Dr. Max.
Dr. Faulkner, before you start talking, is it possible we can get another light on you? Because you're coming in very dark. Now, if that's not possible, that's fine. But just, we want to be able to see you as rather than a shadow of yourself. That's a little bit better.
I don't know if that's helping.
That's actually, yes, a little bit.
Okay.
Thank you.
Okay. All right. Well, as I mentioned, I'm very pleased to be here and to share a few thoughts having to do with dentistry and how it relates to systemic diseases that basically are plaguing our people. In particular, we have the COVID-19, which is an issue that everybody is concerned with. And as Dr. Maxey has alluded to, we do have a situation where the oral pharynx is the major portal for where this disease enters and, for that matter, exits. So there are several systemic manifestations that are associated with oral manifestations. If you ever went to a physician to get your physical exam, you notice one of the first things that they ask you to do is to open your mouth and say, ah. And there's a reason for that. The mouth is a basic window, one of the basic windows for the status of our overall health. And in so doing, certain signs are very obvious to us. And more importantly, suggestive to us for other systemic disorders that may be taking place. Without going into a lot of medical detail on it, there are some things that I do need to mention medically that would make sense. Periodontal disease and cavities. Those are the two things I want to mention. Cavities, dental caries. That is the most prevalent chronic disease among men on Earth, mankind on Earth, I should say. Particularly among the youth. And when that particular disease begins to fall in its frequency among the humans, what happens is the adult now begin to take over with periodontal disease. So either way, oral diseases in the mouth that are particularly to the mouth are very prevalent and are among the list of chronic diseases, the highest chronic diseases that are known to man here on Earth. With that comes the fact, moving over to the periodontal side, there is the direct association with periodontal disease and other systemic diseases that basically affect our bodies. There is a protein in particular called the C-reactive protein. Now, what happens is this particular protein, when someone has periodontal disease, bacteria from the periodontal disease gets into the blood. When it gets into our blood, it raises the presence of the C-reactive protein, the CPR, which basically is it reacts to inflammation. That's basically what it does. So, but it does it in an untoward effect where it actually causes different diseases or complications and embarrassments for different organs that we have, particularly the heart, where we find it most prevalent as an issue. However, we do find that there is an elevation of the C-reactive protein in patients that have prostate cancer, kidney disease, liver problems. The C-reactive protein actually comes from the liver. It is from a hepatic source. So I say that to say that with the comorbid conditions that we have, and being able to distinguish when we look in someone's mouth if whether or not they have the coronavirus, it masks the situation since the conditions that are there are all similar. They're the very same. So one of the main things we look for is if there's a dry mouth, if there's periodontal disease. Well, if you have a dry mouth, we find that is common in patients that have diabetes, renal disorders, heart disease, HIV, this a myriad of diseases. This is just a very common symptom that we also find in the mouth. So patients that present to us now with COVID, it's hard to tell if whether or not that is the situation. It's being masked. Which one is causing which? So the main thing is that we end up falling back on the very same situation where we have to take these patients and consider them all of them to be infected unless otherwise proven. When the patient comes into the office or into the grocery store or into our homes, we don't know if that patient is in fact infected or not. So we have to take every precaution like Dr. Maxey is saying and assume that that is the case. So right now, research on these areas, there's not enough research. What we do know, as everybody else knows, the incidence is going up. It's not going down. My personal opinion is that we're opening up too soon. And this is the first wave. It is affecting us. And it's going to get worse before it gets better. And in terms of different for the second wave, no one really knows. No one really knows. But going back to the dental side, as far as the different conditions that we do have, it is very important that as far as getting checked and looking for different things, if your teeth bleed, that's an issue. Does it mean you have COVID? No, it means you have periodontal disease. And, but still, the periodontal disease may also mean that you have heart disease. It might also mean that you have a problem with your prostate. It could mean other kinds of issues because we do find that they are correlated as far as that's concerned. It is genetic as well, periodontal disease. And my emphasis is a lot on the periodontal disease because I found that medically it really correlates with a lot of our systemic conditions. So, and it is very predominant among our people. So it's predominant in Blacks. Stress has a part to do with it, but it's not that Blacks are stressed and this is why they have it. It seems to be more along the genetic lines as far as that's concerned. Our oral hygiene is another factor. So these are all factors: stress, genetics, our oral hygiene, our diet. If we have diets that are high in sugar, it feeds bacteria. These are anaerobic bacteria that basically are in our system that would cause periodontal disease. We all hear about plaque and tartar, but the advertisements and so on don't tell you what they do necessarily. Plaque is a soft substance that's on the teeth, but it gets hard. It remains. And if it remains, once it gets hard, then it begins to eat away the bone. That's the main thing that holds the teeth in place. That continues. That's the number one reason why we lose our teeth. And that happens later in age. Once you get past 30, you begin finding more and more of that. Now, at the age of 30, 47% of the population has periodontal disease. By the age 65, 72% actually have periodontal disease. So it's very prevalent, but the main thing is that it is preventable. So, every measure should be taken to really try to avoid this because it is something that can be treated. If you do have a condition with your heart, or if you have had joint replacements or anything to that nature, and you have periodontal disease, then you are at risk of embarrassing those areas, causing heart attacks, particularly if it's a valvular situation with your heart, with your joints. If you just had a joint replacement or some sort of a prosthesis, then it's very important to go ahead and have yourself protected with antibiotics prior to any kind of dental work, or even if you're just walking around with bleeding teeth. You're keeping yourself at risk. So very important that you see your doctor to make sure that these issues are addressed preventatively. As far as daily maintenance, a lot of people feel that when I ask them what kind of toothbrush do you use, and a lot of them ask me what kind of toothbrush do you use. Strangely enough, a lot would say that the brush that they use is hard, it's medium. The brush to use is a soft brush because the bristles therefore can get into the areas where your debris is. If it's hard, then other bristles stop it from getting into the crevices. So it's important that these just simple education on what types of brush to use, how often to brush. I live with twice a day, and they ask how long to floss. Well, if I can get my patients to floss once a day, I'm happy. Whenever you ask the question, you always, no one likes to say they don't floss. They don't like to, they may say they only brush once a day and so on. So prevention is better than cure. That's the main thing. If we can educate ourselves on those factors, we can avoid a lot of problems with our mouth. And then as far as just regular visits to your dentist, you find that the dentist may be able to find things that would suggest you see your physician to make further research on your diabetes being one. Of course, we screen for oral cancer all the time, and that is very prevalent. We're finding that more in younger people as well, the oral cancer, based on the HPV virus. So, a lot of these things are really coming up more and more. So it's really good to educate yourselves on it. I know I only have 7 minutes. I'm trying to keep it empirical keep it simple. And I'm hoping that the information would reach some people so they'll understand what's going on. If anybody has any further questions and would like to go further on it or deeper into scope of what we're discussing, please don't hesitate to give me a call, and Dr. Maxey can give you information to contact me, and I'll be happy to entertain any other questions. Dr. Maxey, I think you're muted.
Thank you, Dr. Faulkner. If you could stick around as long as you can, I know you have a prior obligation, but thank you again very much. Our other speaker that has a time challenge is Dr. Randy Hawkins, who I introduced earlier, and he's going to speak on the issues of pulmonary medicine. And we do know that part of this is acute respiratory distress syndrome, which can lead to intubation and death. Dr. Hawkins?
Thank you very much, Dr. Maxey and all the other folks on the calls, seen and not seen. So as Dr. Maxey said, you can see I'm an African-American physician. I'm in private practice for over 30 years in Los Angeles, actually in the city of Inglewood. I am a lung and critical care specialist, which means I'm one of those folks who are taking care of those folks in the intensive care unit, both on or off the ventilator. I am a member of the Medical Board of California, and I am a member of one of the Food and Drug Administration's advisory committees. And although I've not had symptoms heretofore of coronavirus, I have been tested. I'm going to talk about two things. The first time I spoke at length about the coronavirus presentation, including symptoms, treatment, which was limited, et cetera. Today, I'm going to talk about two things. I'm going to give an update of important changes or important factors regarding coronavirus. And I'm going to talk about something you already heard before, and I suspect you're going to hear a lot more because it's very critical. I'm going to talk about personal responsibility in the coronavirus era. So I'm going to start with the update. Still disproportionate impact on vulnerable communities. And what are the vulnerable communities? The vulnerable communities are those over the age of 80, African Americans, Hispanics, Native American, those folks who have increased exposures. Many of us look like us because we're out there on the front lines. They're driving the buses, we're cleaning up the hospitals, we're in the grocery stores. These are the folks at increased risk. Increasingly, however, there have been folks hospitalized that are younger than the age of 40. And so that although previously we thought that, well, the disproportionate risk includes some people I mentioned before and those in nursing homes, increasingly we're hearing and seeing that those under the age of 40 are being hospitalized. And if you're hospitalized, that means you're sick. And some of those are critically hospitalized on ventilators due to lung complications from coronavirus. There have been, as you have heard and read over the past week or so, increasing number of positive individuals. Those are being tested are being positive. Dr. Maxey mentioned some of those states and cities where there's been a bump in coronavirus positivity where those folks are tested. And what that means is that there's increased community spread. Folks are being positive because they've been exposed to someone else who has the coronavirus. And I would remind everybody on the call that you don't have to be symptomatic to spread the virus. And I think many of you know that although the coronavirus is related to the common cold virus, is not. And we've already been told before that, well, you can have, before you have the cold, that's when you're most infected. So before you start sneezing with a sore throat, you can spread it to those close to you because the virus is there. So we know that folks who don't have symptoms can spread and do spread the coronavirus, particularly to those of that are disproportionately affected and vulnerable. 2 drugs are available to treat those critically ill. One is the antiviral drug remdesivir, which has been proven to reduce the duration of hospitalization. And the second is the use of the corticosteroid, the steroid drug dexamethasone. These actually improve the outcome in individuals who have severe disease. So it's not someone who has a coronavirus, is at home because they're not sick enough to be hospitalized. And I need to remind everybody that hydroxychloroquine has no place in the prevention or the treatment of coronavirus. So folks should not be using hydroxychloroquine unless they have an indication of that from the physician. Those are rheumatoid arthritis, lupus, and et cetera. I want to emphasize, and I hope others will emphasize it so you don't hear it enough, so it becomes an echo in your head. We must take personal responsibility in the prevention of the spread of coronavirus. And it's about, we're required to do that. We must do that. Randall gave the example of the person in the grocery store. There's still folks who believe that this is not real. The coronavirus pandemic is real. It is absolutely real. The loss of life of 125,000 Americans did occur. The loss of life of 490,000 persons worldwide did occur. The pandemic has had devastation impacts. And I agree with Dr. Faulkner, and I suspect we'll hear from others, it's going to be with us for a while. We're probably in the first wave. You looked at some of those curves nationally, internationally rather, and we see how some of the countries like Italy, Spain, Germany, the numbers are down. And those folks, they see what we're doing here and they're saying, you can't come here and bring that virus with you here. We work hard to get it down and work hard by loss of life. So the pandemic has devastating effects, loss of life, loss of income, loss of security, and it's exposed our collective vulnerability. We see, hey, this thing is real. It is real. My second big category is that we have to take personal responsibility. We have an obligation. It is an obligation. We have an obligation to educate ourselves, and those on the calls are doing it today. You're being educated on how the virus works and what's important. You have to ask yourself, how does this virus specifically affect me and my community? And you have to define what community means. Does your community mean just your family? Does your community mean the collective African-American community? Does it mean your city? Do you believe that you should reach out nationally and internationally? You can define what community means to you. What can you do as an individual and possibly as a community to mitigate the impact of the pandemic? We all have to think creatively and deeply about, but not rely totally on what the CDC says. The CDC and those guidelines are accurate. They're doing their best job. And the local public health, at least in California, Los Angeles County, they're thoughtful and accurate. You should follow the guidelines, but you should not discard science. You should not say, in my opinion, and I know from which I speak, that I'm going to do this and it's totally contrary to the science. You should not do that. Follow the guidelines. Get tested. I've never symptomatic. I got tested. We need to know what the denominator was or what the denominator is. Get tested so you know your status and you know, am I at risk of spreading it to my mother, my father, my grandmother, my coworkers, my vulnerable granddaughter or godchild because I'm COVID positive. Get tested. Wear face coverings when you're out in public or come in contact with others who may come into your home for essential reasons. Social distancing of at least 6 feet. Wash your hands frequently for at least 20 seconds. And in closing, think deeply and responsibly. And that's what you can do to reduce community spread, this virus to vulnerable populations. Write your own history. Thank you.
Thank you very much, Dr. Hawkins. I appreciate your astute presentations. Again, I ask you to stick around as long as you can, since you have a prior obligation.
I will be. Well, yes, Randall. Yes.
I want to go to our next speaker, who is Dr. Ann Stavern, who is a noted allergist, immunologist, pediatrician, and I always say the physician to my 2 youngest kids who are now adults. But before I do, and everybody's been speaking about old patients. Well, I had my 78th birthday in December, and my kids gave me a present to go and see a noted entertainer named Jeffrey Osborne and the OJs, and I had a ball. We partied in the halls and in the aisles, and I understand Jeffrey is with us today. I hope he is. Say hello if you are. And he's a woo-woo guy. But let's go to Dr. Ann Savern. Dr. Savern.
Yes, can you hear me, everyone?
Yes.
Okay, very good. Well, good afternoon, and I wanted to thank Dr. Hawkins for that excellent presentation and everything he says. I will most likely reinforce. I am a emeritus physician partner from Kaiser Permanente Los Angeles Medical Center. I practice pediatrics and allergy and immunology in the Los Angeles area for over 30 years as well. And today I'd just like to go over some things in general regarding our children and how the COVID-19 virus is manifested in that population and how it pertains to the adult population, because this is a fairly interesting virus with regards to how the young people are affected versus the adult population. First of all, in the pediatric population, there are fewer cases of COVID-19. It makes up approximately 2% of the total cases in the country of those that have been tested. So you can see, based on the population, it is very small. The symptoms are milder. They have less hospitalizations. They have minimal ICU hospitalizations, about less than 1%. And a greater percentage of these children are asymptomatic or pre-symptomatic. And what that means, as Dr. Hawkins said, that even though a child may not have symptoms, they may put others at risk to getting the virus. The good news is, child to child, there's less transmission. And I think that's going to be good news for school opening, that most children are not getting it from other children. They're getting it from an adult, usually adult in the household or some community exposure, like a teacher. And we should also note, we don't have the data for the United States, but for children with pre-morbid condition, who have comorbid conditions, not pre, they may be at slighter risk. We really don't have that data, but there was an article in Lancet in the United Kingdom that would suggest that, like adults, different ethnic groups, different ethnic groups in the children's population, you may have more susceptibility and may become more ill with the virus. That has not been proven. However, we'll talk a little bit about what I think should be done about certain comorbid conditions regarding children. So the good news is that fewer cases, less symptoms, milder symptoms. Kids are not transmitting it at a high rate to other children. The incubation period is still 10 to 14 days like adults. They still get cough, fever, runny nose, sore throat, fatigue, muscle ache. But it should be noted that cough and fever are the primary symptoms for children, and they seem to have more upper respiratory. They have less lower respiratory, so less pulmonary symptoms in general. And a great deal of children may not have fever and still have the virus. So again, they can be a source of infection for the high-risk adult groups. If these children do become sick, the overall progression of the disease is very mild, very few deaths, And as I said before, minimal hospitalization for these patients. Now, the special populations are one, the infant less than 12 months of age. They can become very, very ill. And so if you have a household that has a very small child, infant, a baby, cautions, preventative cautions should be strictly adhered to. Also, it's becoming more prominent with regards to the data that pregnant women can become very ill. There's no transmission from the pregnant mom to the infant, but there is virus in the breast milk. So I personally would probably not breastfeed if I had a mom who was positive for COVID-19. But I would be very aggressive in saying that that household should practice the precautions with a pregnant woman or a baby in the house. And then, of course, you have the elderly or the older population, which somehow I fell into. I didn't understand that. But the older 60, 65-year-old patients, as well as those with underlying conditions, asthma, cardiovascular, cancer, immunosuppressing drugs, they're also at greater risk. Now, for children, probably, especially for African-American children, I would say asthma would be the #1 comorbid condition that we should be aware of, and parents should, monitor those children. 2, this is not the time not to take your medicine. It's not the time not to take your asthma medication for your children. Their asthma should be well controlled, because you just don't want to put them at greater risk if they happen to get COVID-19. You put them at a disadvantage, and it's really, as said before, it's not necessary. It can be prevented if the asthma is under control. You're not going to worry about those additional complications with pulmonary respiratory problems. I'm going to leave the multi-system inflammatory syndrome alone. It's very rare. If someone has a specific question about it, we can talk about it. Now, what are the steps to preventing the spreads? We've heard them, and I'm just going to reiterate them because they're very, very important. Hand washing. Again, hand washing. Soap, water, hand sanitizers, over 20 seconds. Social distancing, 6 feet from people who are outside of your household. If you can't be 6 feet, or if you're in a crowd, I would say, of greater than 8 to 10 people, you should wear a mask, and children over 2 years of age in public settings should wear a mask. With regards to the house, cleaning and disinfecting high touch areas, doorknobs, table surfaces, light switch, appliance knobs, anything where there's multiple touching should have a cleaning and disinfecting schedule. Laundry, stuffed animals, or blankets that are being carried around or used a lot by children should be laundered frequently. Good news, if you have someone who has the COVID-19 virus, you can launder the clothes together. There is nothing that suggests that when you put it into the washing machine that it would stick around and cause a secondary infection. Now, what about playing? What are we going to do about kids who are going to have to play and go to school? Well, overall, we still should avoid play dates with children outside of your household. As has been said before, we probably opened up a little too soon. California is spiking. So I would avoid outside household play dates. Again, 6 feet distancing from people outside of the home. Older adults, probably you should avoid the grandparent visits, auntie visits, if they live outside your home or have comorbid conditions, I would probably avoid it. Now, a little caveat about childcare. If, and our folks, some people, they don't have an alternative. They have to have grandma, or they have to have auntie, or someone who's older taking care of the children. Well, in this case, the children really should be kept separate from people who are not in the household. That you have to be more careful with that, because you could then bring it to the older person or the person with higher risk. So that's something to note. If your child care giver is older or high risk, the children should probably be separated from other people who are in the household. Also, with regards to what we think is going to happen in the classroom, what's probably going to happen is that the teacher and the class will become a cohort, a unit. And that unit is probably going to be separated from the other classes and teacher units. And what that means is that you're not going to have this commingling of people in different classes, let's say in the play area. They will be using masks, and the school will have a filtering air system. They'll have to disinfect the surfaces frequently. Sports, I'm not an expert on that, but they will probably have minimal to no audience participation in terms of having parents who are coming to watch their children play. Some sports like wrestling probably won't happen. I don't know. I haven't really been able to speak to someone in the school system to see exactly what they're going to do there. They may have to require respiratory mask if they're playing something like football where you're getting close or grabbing someone. And again, the interaction, say, with coaches or staff that's helping, they'll have to wear masks. They'll have to try to social distance. So there is some good news in that the children probably are less likely to get the infection, and when they do, it's milder. But on the other hand, they could be a source of infection for the rest of the household. And I do believe that the schools will open up, but it will be a little different, and perhaps they may split the school year in some virtual manner so that the size of classrooms and the number of children that are in the physical building may be reduced. So that's all I have for this afternoon. I will be available for questions, and thank you very much.
Thank you very much, Dr. Sabern.
Thanks,
I
Sam.
appreciate the presentation. Is Dr. Georges Benjamin on by any chance? Dr. Benjamin? Okay, I do know that Dr. Ron K. Bailey is on. Ron, are you able to unmute? Okay, I'm batting 100 right now. Let's go to some questions for our current speakers. To Dr. Ann Sabern, Dr. Faulkner, and Dr. Hawkins. Some years ago, I taught in the College of Dentistry at Howard University. I became very impressed by the medical diseases that were affected by what we thought at the time was a separate profession, dentistry. But in fact, dentistry affects every aspect of the human body. And you mentioned heart disease and lung disease, infectious disease. But I'd like a little discussion on how we can get those issues addressed. I'm also talked with an OBGYN friend of mine in Texas yesterday, and she told me that they're actually doing emergency C-sections on women who have died from COVID, but they do an emergency C-section to deliver that infant. And I know Dr. Stavern also brought up the very interesting point of COVID being transmitted through breast milk. And for Dr. Hawkins, I know that recently there's been a study done that showed, and they had to stop the study because people were living longer if they used Depomedrol in their treatment, or dexamethasone rather. And we also know that oxygenation in the amount has an effect. So if we could just address some of those, and as well as hear some of the questions in the chat box. Doctors, Dr. Faulkner?
Yeah, well, as far as oxygenation in the mouth is concerned, the oxygen releasing agents are effective. A 1.5% solution of sodium hydroxide has been effective and suggested as a pre-rinse prior to treatment of dental patients. Generally, I have the patients on a 50% half water, half hydrogen peroxide rinse. Just as an antibiotic type of a rinse, even before COVID, I've had them to do this just as far as post-surgery and even in cases of pre-surgery. So it is effective as far as that's concerned. Contrary to our president, the other oxygen releasing agent, the sodium hypochlorite, which is bleach, do not gargle or do anything else with that. I have heard of people who decided that small concentrations of it in the mouth is conducive to good health and that it will kill. Well, you're only right in one aspect. It will kill. Yeah, it will destroy the virus, but it may also have an untoward effect towards you. I just suggest you keep bleach off of your body, period. But as far as the other oxygen releasing agent, the peroxide basically is good. And you can use that, as I mentioned, up to 50%. As far as the ADA is concerned, CDC is concerned, 1.5 solution is acceptable with regards to that. As far as surfaces and so on is concerned, my main thing with that, my background is in microbiology. I feel that situations where money, credit cards, things of that nature, all of those things are they're vectors as far as that's concerned. If you have a credit card and it is contaminated, you picture that credit card as having powder on it. If you put it into a machine and you pull it out, you're going to leave powder in there. And the next person comes along with a clean credit card and they do the same thing. Well, what's going to happen is you're going to end up with powder on your credit card. Powder is a lot less transferable than is this virus as far as that's concerned. So it just makes common sense that we need to watch things like that. I mean, I've heard people say, well, I wash my hands, or I put 70% hand sanitizer on my hand after I finish using the keypad. And that's great, but you still have a contaminated card as far as I'm concerned. So there's different things, and there's different statistics out now having to do with money. They tend to be turning it down, saying, well, it's not as bad. And then it keeps reversing itself. Now there's a study came out of France that said plastics in particular seem to house this bacteria for longer periods of time. And they're finding out that metal money seems to house it longer than paper money. Guess what? Everybody's guessing. And I would say it just makes common sense, because even before the virus was concerned, like on cruise ships and so forth, I've always and have instructed my friends and family to always sanitize their hands after coming from the buffet. You see other passengers handling the utensils and licking their fingers, and I'm a germaphobe, and there's certain things that nauseate me. that's why these cruise ships came down with such infectious percentages and throughout. So listen, public, the way we conduct ourselves in doing things, we need to be careful. This is a thing of habit. And hopefully now, if you know, one door shuts, another one opens, hopefully we learn to be cleaner. And it's not going to hurt anybody to just be cleaner because of this. You know, people think you're paranoid and they call you, you know, germaphobe. I'm okay with that. I'm okay with being that. I just think that you know, cleanliness is what's going to help us in this situation going forward.
Dr. Maxey, may I respond to your comment? I do have to come off the call momentarily. May I proceed?
Yes.
Okay.
Yes.
So the discussion revolves around the finding that the use of steroids, in this case, dexamethasone, some of our panelists and folks in the community may know about prednisone or Medrol as a oral form of steroid being used for various conditions that involve immunity or autoimmune conditions. So we've known for some time that damage to the periphery, the edge of the lung, those alveolar cells, those cells that involve an exchange of oxygen, really respond only a couple ways. You can have what's called diffuse alveolar damage, where there's inflammation, overgrowth of cells, and given enough time, it may go on to cause scar tissue, so-called fibrosis of the lungs. And there have been studies, multiple studies in the past, where we've used people at high risk for developing the adult respiratory distress syndrome, where there's a severe reaction to the lung to some insult, and using the steroid beforehand. And we've shown that this is not effective. We've known, and I've known for some time when I've had patients who've had a particular condition, not coronavirus related, but some condition that resulted in a inflammation or overreaction to the lungs to, say, a bacterial infection or some other insult. Maybe it was a reaction to a drug that was used to treat a different condition. If we use steroids, it could reduce the amount of inflammation and promote healing. Like so many other things, these drugs have another side, an alternative side, a potential side effect with increased risk for bacterial infections and diabetic, elevation of the steroid glucose level, and complications of excess glucose due to steroids. But we're using this dexamethasone in people who are most severely ill to modulate and reduce the amount of inflammation that's caused by the virus. There have been some studies that there have been bacterial, at least infection endocolonization as part of the coronavirus inflammation or infective process. It's not always clear that these bacteria are actually causing bacterial pneumonia. They may just be bystanders. So the more experience the clinician has in pulmonary and critical care medicine and coronavirus, the better their patient is likely to do. There are ongoing other studies with other drugs and other modalities to see if we can modulate or mitigate the complications for this coronavirus. It's going to be here for a while. So unfortunately, there are probably ample need for additional modalities. I would like to ask Dr. Sterian if I could. Dr. Sterian, do we know why and what can we learn from this less transmission between children? Do we understand why that occurs? And do we know, what can we learn from that? That's my response to my question, Dr. Maxey. I'm sorry.
Quick one for you before you leave.
Okay.
There was another study done, I want Dr. Saban to answer. There was another study done with conservative oxygen and with liberal use of oxygen, and having nothing to do with politics. But they stopped the study because the patients that were dying were the ones that the oxygen was being given conservatively to, and high flow oxygen seemed to be much better. Are you familiar with that particular study?
I am not. Ramsey, do you know what the rate was? The high flow rate with, I'm not familiar with that particular study, and I'm just trying to see if I can speculate from a.
That was on the CD site on the 23rd of May.
On what site?
I think on the CDC site.
Ah, okay. And this is when all other things were being equal. The only variable was the oxygen flow.
Right.
And were they on ventilators, Randall?
No,
No,
not on ventilators.
I don't know. Ann, are you aware of that? Or anyone else
No.
aware of that?
What?
I'm not sure why that would be.
Either. I'm not quite sure. No.
Why don't you answer his question then, Ann, to you?
There are a couple of thoughts. I'm sorry, this little echo. A couple of thoughts about children. One is what they call viral hindrance, that children tend to have a lot of viral infections, which we know they're like little germ centers. And anyone who's not been around children, if you start being around them, you can become very, very sick or ill because you haven't been around and had that antibody. I remember just a caveat, when I got married, I told my husband I was in pediatrics, he's going to get sick. He said he'd never been sick a day in his life. Well, within 1 month, home 7 to 10 days, because I was doing a lot of pediatric work at that time. So they think that maybe they have a viral hindrance. They might have actually seen something like the COVID virus and have some antibody. That would be an interesting study for some of my colleagues could do. And because their symptoms are milder, perhaps they don't cough or sneeze as much or have as much droplet spread. This is all theoretical. They have not come up with a specific reason why it is less, but those are thoughts of why it possibly is less.
You know, another thing, Ann, and I'm sorry, Dr. Maxey, this idea about the breastfeeding and it being in milk, you know, the question would be a balancing act. We know that passive immunity is so important, and bonding with the infant with the mother is so important.
Yeah.
So I wonder if you might comment about that, or if there's any other pediatricians or those who feel strongly about it, comment about the fact of not breastfeeding and not having that bonding, and the infant not getting that passive immunity from the mother for other things that they may be exposed to.
You know, that's a very excellent question, and I think we're in a kind of hypervigilance mode because we don't know much about this virus. It is a novel coronavirus. Certainly, we know that some viruses can be in the breast milk, and they do not cause infection in the infant, while others may, or different diseases. So I think it's a side of caution. I think at this particular point that to be super safe, some would suggest that you do not breastfeed. And because infants under 12 months of age are making up a larger cohort of children being hospitalized or becoming very ill, I think at this point, pre-vaccine or a good antiviral, they'll just have to work on the bonding issue outside of breastfeeding. Unless someone says it's breast or milk, perhaps treat it in some way, say, i.e. heat it, then you can give the child the breast milk, that it would be safer. That may be a possibility, but I think until someone says definitively, you can't transmit, or you can break down the virus so that it's not infectious, if by heating breast milk, I personally would avoid it. Anybody have any other thoughts from the OB side? I don't know.
Thank you very much.
Okay, let me put another question to you, Dr. Stavern. We had a rigorous debate in the Medical Society meeting the other night on the subject of vaccines, and you had a very strong statement. I wonder if you would put that back out, because we know that we are trying to make vaccines, and we know that at this time there's no real treatment. Can you comment on your view of vaccines and why they may be important?
Yes, Maxie, of course, it's allergy immunology. That is my board. So I do believe in vaccines. I know that there's issues of efficacy and safety, but I just want to say that if someone ran a computer model and you took out vaccines, where would we be in this world today? Where would you be? You're walking without a limp. You don't have to get in a wheelchair because you didn't have polio. Your children are living because they didn't get measles. Have you ever been in a hospital and seen a baby turning dusty because they have pertussis and there's nothing you can do about that? What about H flu? How many people have we seen when we were training? If you're not that old, I am, who died of H flu, epiglottitis, H meningitis. Vaccines are the only reason we're not living like a third world country, one. Two, if you're complaining about vaccines, you have the luxury of complaining about a vaccine because you have benefited from a vaccine. You didn't get smallpox, mumps, measles. So you're around to now say, well, maybe we don't need them. The truth of the matter is, for most viruses, HIV is an exception. In order to control viral infection globally, it's with the vaccine. Now, if they come up with an antiviral, like they have with HIV, that will work in the same manner, take a pill once a day, but no, you have to take it daily. There's nothing where you just take a pill and then you live your life. Then perhaps there may be some alternative, but short of that, I think in order for us to get on top of this infection, we're going to have some kind of vaccine unless we have a very efficacious antiviral. I also think it'll be like flu in that you'll probably have to take it yearly. I don't imagine you would take a single injection like for pneumococcal, for instance. So I feel very strongly about it. I took care of very sick children who had these diseases we hardly talk about now. And of course, then the parents, they want the vaccine. The child is in the hospital, can't breathe. But at that point, I'm trying to remember, if any of you can remember, was it about, how long ago was that? Maybe 7 or 8 years ago, but nobody wanted to take a certain flu vaccine, and then that flu came in, and I know people were breaking down the doors to get their flu vaccine. They talked about it, they didn't want the flu vaccine. People were being hospitalized with pneumonia. I just think it's very important. I feel strongly about it. I know it's controversial, but you have the luxury of being controversial because we've eradicated a lot of diseases and or controlled them. That's it.
Thank you. I had a patient several days ago, and they had complained of some weakness and fatigue. I drew blood and I got an emergency call back from Quest Labs day before yesterday that their blood glucose was 30. Now, that can be deadly. So I was extremely worried about the patient, and I said, I'm so worried. I even looked up to make sure there was not some part of her that I had overlooked. Could it have been hepatic cancer? Could have been a form of diabetes? Could it be a pancreatitis? Or what could it possibly be? So I called her up and I told her about the results, and she started laughing. Says, oh, my family has a history of diabetes, so I was just taking a chromium pill to avoid diabetes. And it occurred to me that a lot of people take things because they're natural, or they say they're natural, and presuming that means that they're not potentially harmful. And I'm throwing this out in that as we go forward, we might discuss it today. We're going to talk about integrative medicine and natural medicine and what some people now look at disdain with Western medicine. But I think the problem is we have a lot of, I don't want to use the word ignorance, but ignorance meaning not having knowledge about what you're taking. And just because arsenic is natural, but it can also kill you. So we're going to talk about some education on some of these things, but Dr. Hawkins, Dr. Faulkner, Dr. Stavern, if you had a patient to come in with something abnormal and they finally told you they were taking something from the health food store, but didn't tell you in your history, how would you approach that? And how could that be dangerous? And especially in this situation where we have a president walking around telling you to inject yourself with chlorine or other medications. Anybody want to answer that? And I'm going to ask Michelle if there's anything in the chat box.
I want to jump ahead. I'm gonna jump ahead, random. So I was supposed to come off the line, but I had to listen to your vaccine question. And I was in that meeting with Dr. Stanford and the Medical Society in Los Angeles, and it was there were strong opinions on both sides of that question. And my only comment about this, Randall, and my next conference is with my medical students who are about to go on their first clinical rotation. And one of the things I'll remind them is that drugs and supplements can do anything. And when you do a history and you're trying to figure out what's wrong with someone, you always have to ask the question, what medications are you taking and how you're taking them? And what supplements are you taking and how you're taking them? And please bring them in if you don't know the names of them or write them down, because they can do anything. There's an obligation to make an inquiry about what people are putting in and on their body. Now, there's no question that the basis of pharmaceutical has to do with herbal medicine, in the sense that a lot of what we discovered about drugs that work, whether it's cancer or other things, come from nature, come from our inventory of chemicals that look like things that work, that we know work, and put in, people do a mass spectrometry on a particular drug that's important in treating lymphoma. And they say, well, let's try to find something in nature that looks similar to that. And so we're always stealing things, learning from nature. So it's a balancing act. Like so many other things, it's not black or white, it's gray. And we have to ask, in my opinion, what people are putting in their body, and don't accept that everything you're told and read is accurate. Do your own research, investigate, be critical. That's my comment.
Thank you. Dr. Faulkner, in your practice, do you see this issue?
Yes, one of the main things that I found really has been among the youth and middle-aged, actually, and that's for the use of cannabis. We have quite a bit of that going on, and just the week before last, we ended up diagnosing a patient who's 22 years old with squamous cell carcinoma as a result of his use of that. He didn't smoke tobacco. The only thing he smoked was this. So, yeah, it's looked upon as a panacea for all types of ailments and anxiety, depression, and, well, you name it. And there's someone promoting cannabis who's going to tell you that it's a cure for it. And I'm sure that if you look at the records, you're going to find that there's probably an increase of cancer as a result of the use of cannabis. The way to scale in terms of what the benefits are, as opposed to the untoward effects. So, yeah, this is something that I found to be the case. It's a concern. So, and as you know, it comes from creams. I don't know if the dermatologists have found anything there. But we tend to put different things in our systems and think that they're good for us. Energy drinks. If anybody knows anybody drinking energy drinks, please tell them stop. It is absolutely tearing. It's very acidic, very low pH. It just I've had patients that perfectly good teeth, and I thought that I was suspecting that this patient was bulimic, or just regurgitating and not letting anybody know what was going on, because I've had cases like that in the past. And he said, no, I'm not doing that. I'm not doing that. So I said, okay, well, Then as I asked further, come to find out it's, the energy drink, but I had no suspicion that that would cause that rampantly. And so I followed the case with other cases. And when I started seeing these lesions pop up, I would ask, and sure enough, it's energy drinks. So energy drinks tear up the enamel of the teeth.
Oh, wow.
And if you otherwise had healthy teeth, they will destroy them. So please stay away from energy drinks. Cannabis on the soft tissues is wreaking havoc, especially on our younger people. So, we need to watch that as well. And now they've legalized it. Everybody feels they could just go ahead and just smoke their lives away. I mean, I'm sure that it has to, be affecting our lungs as well. We have a pulmonologist there who can probably have some information on that as well. But in any case, yeah, that's been the main thing that I found, self-medicating.
Well, thank you. Is Dr. Tyler on the line by any chance?
Yes,
Dr.
I
Carey?
am. Yes, I am. Can you hear me?
Yes. You and I had a brief discussion about this patient with a glucose of 30, but in terms of what Dr. Faulkner raised, have you got any information on cannabis and or CBD on its health effects, benefits or non-benefits of that you could speak on for a couple of seconds?
Well, I wasn't prepared for that, but we do have an endocannabinoid system that is in the body. We have the receptors for cannabis in the body. So there's a reason why they're there. And marijuana, CBD oil, they act upon those receptors. There's a lot of literature out there about the benefits of marijuana, CBD oil. The thing is, you have to look at the sources of those products, and you have to look at the dosages of those products. A lot of times people don't know what they're getting. They don't know what they're buying, and they don't know how much is recommended or how much has been used in the studies that have been done. So there is a lot of literature on there. You can go to PubMed. There have been reports of cancers being cured with marijuana. The problem also with, natural products is that there's not enough money that's put into the research behind them. I think that's going to change. There has been a lot of research with marijuana and cannabis, but remember, there's also the stigma of it. So you have to look at the sources of information. When it comes to supplements in general, the problem is that Western trained doctors have not been educated in the role of supplements and the utility of supplements or nutrition. That is not a part of the Western training. Now, there are a lot of doctors who are going outside of Western medicine and not even outside, but that's where integrative holistic medicine comes in. It's a combination of looking at Western and alternative medicine and finding the evidence for the efficacy of supplements. You have to go to credible sources. I challenge every doctor on this call to take a course in integrative holistic medicine. There's one at the Scripps Integrative Health Institute. Well, now they'll be doing it virtually online. They have 2 courses every year. One is on the evidence basis for supplements. And this is based on data and meta-analyses, which means they've looked at multiple studies. They throw out the bad ones that, don't have enough patients or, it wasn't good quality control or double-blinded placebo controlled. They throw those out. They look at the good studies and they look at the preponderance of evidence. And based upon that, and based upon the dosages that were used, they make, recommendations on what works and what doesn't work. You also have to look at the combinations of things. So it has to be based on some sort of evidence, but there's a lot of evidence out there. I'm going to recommend the Society of Integrative Holistic Medicine, and also the Institute of Functional Medicine. And they have the evidence and the weight of the evidence, like whether it's good evidence, whether it's, you know, how they're rating now studies, they're rating them according to how good is the evidence. And they have that for supplements as well. So the problem is a lot of people would just go online and just look something up and find an article and they would use that. You have to go to where there have been studies and where there's been usage of the information from those studies and recommendations based on that.
Let me retrospectively introduce Dr. Tyler, who's a colleague of mine. She graduated undergrad from a little school on the East Coast called MIT. She's an engineer. Then she went to a little school on the West Coast named Stanford, where she went to medical school. She is currently a radiologist, an ultrasonographer, and she's also boarded in integrative medicine. And I've asked her on a call 3 weeks from now, along with Dr. Lamont Gibson, to bring us up to date on integrative medicine and this interface between what people call Western medicine. And I guarantee you that will be a live session. Are there some questions, Michelle or Simon, in the chat box that we can discuss?
Hi. There are not a lot of questions. There's some really good information on anti-inflammatories and nasal rinses and antioxidants and antimicrobials in the chat box. I urge everyone to take a look in there. It's from our brother Thurston Bilal. So let's check that out before you hang up from the call. And just one question, it says, from a layman's perspective, how do we trust a vaccine that seems to be a one-size-fits-all when we see messages on social media or otherwise stating that the coffins that they're stockpiling are for all of the people the vaccine, not COVID, is likely to kill? That is very concerning, if any truth to it. So any advice on how we know who to trust when the vaccine becomes available?
Dr. Maxey, can I make a comment on that?
Okay.
Because I just wanted to make a quick comment regarding vaccines. Again, I'm going to challenge every doctor on this call to look at the evidence that suggests that vaccines are not the answer, the way that they have been formulated and the way that they are being administered. I challenge you to go online and look up studies from doctors, scientists who have looked at the data regarding vaccines. And Dr. Saban, I know you mentioned about the eradication of diseases. Polio and measles were nearly completely eradicated before the vaccines came out. If you look at the data, even the CDC data, it will show that the incidence was already near zero, relatively zero, before the vaccines were administered. The main thing about vaccines, the issue with vaccines is that there's not informed consent. That they're not telling people what all is in the vaccines. It's not just the virus they're putting in the vaccines. They're putting in adjuvants to stimulate the immune system. So I'm just saying that all doctors need to be informed of both sides of the issue and then make a judgment, because there's a lot of evidence out there, and I've mentioned this on calls before, that it has been proven that certain vaccines have been associated with an increased incidence of autism in Black children. And this was revealed by a scientist from the CDC. So I'm saying, look at both sides of the argument.
I'd like to make a comment if I could. Oh, I might have moved it. I'd like to make a comment because you're right. We're at opposite ends of this discussion, and every physician should look and do some research on this issue, on both sides of the issue. I agree with you 100%. I disagree with everything else that's said. From my view, my professional view with regards to the autism study. I believe the studies that say that it's not true. That has been disproven.
And a whistleblower from the CDC.
Hold on.
scientist.
Let her
Okay.
finish her statement, Dr. Tower.
Okay, but it
So
is
that
not.
has been, that has been disproven. We did eradicate smallpox. Again, if you are not up all night having to take care of sick kids or sick children who are having problems with these particular diseases, which we would have en masse, or having deaths, there's a reason, and I know that, of course, there's a reason for skepticism. I don't want it to be adversarial per se, but there is a reason for skepticism. You just sit down and have a talk about what they initially did with the vaccines they did in Africa, what might have happened with HIV. But the proof is in the pudding with regards to childhood mortality and morbidity. And even if you took the number of children with autism, which I believe that study was disproved, the mortality and morbidity of our children has been reduced with vaccines. And you don't have to have your children have them. I mean, you don't have to have them. But we can see the measles outbreaks that we had in California. They didn't vaccinate their children. Now, why is that important? Well, some people say get the disease and, you know, develop your own antibodies. That's fine. But the problem was you have immune suppressed people in the society. And if they get measles or the mumps or COVID, probably for that matter, it could be very bad for them. They're not going to have the luxury of developing antibodies. They could die from having the illness or have significant complications where they're hospitalized on respirators or whatever. So it's a big, big discussion. And believe me, as a pediatrician, every pediatrician has had this discussion with their parents and grandparents and friends, but the proof is in the pudding. You're here, your children are here, and you only, if you didn't give it to them, herd immunity allowed them not to get ill. And there is such thing as herd immunity. And so we can go forward, but no one's going to force you to have a vaccine. But one, you put your child at risk and you put other people in society at risk. So maybe those who don't get vaccines should be in another area so that you don't expose the patient who's on immunosuppressant drugs or doesn't have an immune system. You put them at risk. It's a public health issue. And I think we should probably have a big discussion about vaccines and let each side, you know, bring up the studies they think work. I agree with you. A doctor should look at it.
Let me say this. Coming up next week, hold on. Coming up next week, we're going to have Dr. Georges Benjamin, who is the executive director of the American Public Health Society. And we're going to put this question to him. I'm going to invite, as I said before, Dr. Tyler back, Dr. Sabin back, and we're going to present some of these questions. There are a couple of other things I'd like to accomplish on this call. Ross, I'm going to have you read the letter that we're sending out this week, if you'd get that ready, if you're on. But we've been having this call now for some 12 weeks or so. And it initially started out that I had the idea I wanted to have my family have the information that would protect them. And they started inviting their friends and so forth. And I invited a few of the past presidents of the National Medical Association. And the call now, which started out with about 40 to 50 people, now streams live to over 3,000 people. Even though you only see 40 something online on the Zoom call, it's all over the country. We have people on the call from South Africa, from the Caribbean. And we decided, since there was such a hunger for good, credible information and occasionally credible debate among professionals, And my statement is that nobody cares how much you know until they know how much you care. And our physicians and other health experts that have been on the call, they care about our people. So they make earnest statements and trying to bring you credible information and interpretations of what's there for your safety. So we created, instead of just a casual call, we created a nonprofit organization called the Black Health Trust. We now have a tax ID number. Hopefully by tomorrow we will have an account, and we're going to ask what we call our core people to help us continue this, help us continue the streaming effort. I'd like Mr. Ross Johnson, if he's available, to read that letter that will be coming out by our assistant tomorrow to enlist you to support this effort. Mr. Ross Johnson, are you on?
Absolutely, I am here, and good afternoon. I can actually pick up from the excellent introduction and summary that you just provided, and thank you. And as Dr. Maxey has indicated, we've taken the steps to formalize this discussion in an effort to ensure that we have the experts required in order to accurately and effectively share the information, not just related to COVID, but with healthcare broadly. And I believe Dr. Maxey has been quite successful in doing so to date. Sustaining the efforts of the Black Health Trust has been estimated to require approximately 20 to 30,000 on an annual basis to cover production of this particular call, as well as other administrative needs, and ensuring that the nonprofit itself, Black Health Trust, continues to be able to provide the information necessary with your participation. To support those efforts, Black Health Trust is asking what it considers those founding members to provide a contribution of approximately, or at a minimum, $500 or more to ensure that Black Health Trust is able to continue as it does on a weekly basis, and perhaps in the near future more often. Those members themselves their contributions will support not only the formation of the 501c3, as Dr. Maxey has indicated, but will also be instrumental in the full launch of the Black Health Trust website. It will also assist the Black Health Trust in securing the resources necessary to solicit grants in support of the organization itself. And in addition to that, the production services offered to date. So we certainly welcome your contributions as founding members to the Black Health Trust. And Dr. Maxey, if you have any additional information to add, please do so.
Okay, we do have a website, correct?
Yes, we do.
Can you tell them how to reach it?
They may reach it at blackhealthtrust.org.
Okay, and we have retained a virtual assistant who is probably on the line with us to help with the administrative work. We have a steering committee, many of whose members are online with us to make sure we produce this professionally. And a letter will be going out tomorrow to many of you on the line, repeating what Mr. Johnson has said. I've been able to call him at 3 o'clock in the morning, and Martin Pratt, all hours of the night and day, for help in trying to grow this information. I salute them. We also have a very active steering committee to make this on, and we want to reach out to even more physicians. So I see my mentor doctor, at least I see his name, and we have had prayer for him and his family. But before we move on, I'd like him to say a word on his area of cardiology and how it's affected by COVID. He's been head of our clinical committee with the Select Roundtable. Dr. Richard, are you available? You have to unmute. You have to unmute, Dr. Williams.
Am I unmuted?
Yes, you are,
Yes.
Dr.
Okay. Well, thanks for the condolences. And I don't want to say much about cardiology today. I did want to make a comment about your last comment regarding the creation of the Black Health Trust and as a nonprofit. I think you're right on target in regards to doing this, and congratulate you on forging ahead with this. I just want to make a recommendation to you. When you start something like this, especially when it concerns issues such as what we're dealing with, you have to make sure not only that you get a good start, but that you set up the means for sustaining yourself, surviving. One of the ways of doing that is by applying for grants. It's a much harder process now than it was when I started doing this years ago, but it is still possible. The first thing that you want to do, and this is just by way of advice, not something that you have to do, is to compile a list of, say, foundations which are reasonable for you to apply to. Bear in mind that if they're pharmaceutical companies or corporations, you've got severe restrictions. If they're governmental agencies, you've got a lot of constraints and restraints. So it's not easy, but private foundations are perhaps an easier route to go. And there's one here in California, which I recommend that you appeal to. It's called the California Wellness Foundation. It's headed by a Black lady named Judy Peck. She happened to have had an article, an op-ed article in the LA Times today, which I encourage every one of you on this call to read. It's on page 821 of the LA Times, and I'm looking at it right now. If you read that, you'll understand why I'm recommend that you contact her, because you'll find, I think, that this lady will be in solidarity with your cause. And if that's the case, you may be able to get some bucks from the California Wellness Foundation and some other types of support.
Good.
So I hope that's a practical suggestion to you. Did you want to say something on that, Dr. Maxey?
I wanted to say something just to say that Dr. Williams, who gave me my first opportunity to publish and be a part of a textbook of Black-related diseases a few years back, 2 or 3 years ago, which also placed that book in the American Museum of African History. But he's just released another book on Black physicians, which is out now, and I urge you to look that up. But I thank you, Dr. Williams, for being with us and helping us along on that. We
Can I
have,
make one comment?
go ahead.
You're about to move on, but before you do, while I have this bully pulpit for a moment, I just want to mention something to follow up on what Dr. Ann Stavern mentioned regarding the question of the effectiveness and safety of vaccines. I think the weight of the evidence would show that it is anti-intellectual to think that vaccines are not effective. There is a question about safety, no question about that. But as far as effectiveness is concerned, as she indicated, there's all the reason in the world for us to have confidence that they can work. However, we do have to have concerns about the safety aspect. And in that regard, you mentioned that you were going to have a discussion led, I guess, by Dr. Georges next week.
Yeah.
I would encourage you to have a larger discussion, which might, for instance, be in a debate format, so that more people can enter into the mix on that very important conversation. You're developing messages with this trust, which are going to be going out to a large number of people. And you want to make sure that you get it right, that you're not sending out messages that might be incorrect in this direction. And in order to do that, you've got to make certain that everything that you bring forward here is thoroughly vetted by experts using the best in evidence-based medicine. That's my best recommendation that I can make to you on that issue.
Except,
I agree with. I agree.
all right,
Yeah,
let's move on. I want to hear a brief word of what's going on in Cape Town, South Africa, with your lockdown, with the disease. Is Hal and Betty on? Hal and Betty Walker. Do you see them, Martin?
I see a Dr. Walker. I'm not sure if that's one and the same.
That would be her. Dr.
Okay.
Betty Walker.
They're on mute right now. Dr. Walker, if you can unmute your phone.
So Hal, you got to unmute your phone. You put a man on the moon with your lasers. I know you know how to unmute.
Well, it's also if they can unmute the video too.
Okay, we will come back to him. Are any of our other physician colleagues on right now? And then we'll go to the chat box again.
Oh, there it is. There it is. I had to do it.
Hello. Where's our
Oh, there
video?
you go.
Forget
Awesome.
the video.
It's what time? It's very late here in Cape Town. We're undressed, so
11 o'clock at night.
we're ready for bed. but anyway, thanks for having us say a few words. Yes, of course, I think you all are probably aware from the news and other stories going around that we're still expecting a peak to occur here in South Africa. The virus's hotspots right now are, one of the spots is Cape Town, and another one seems to vary in a country in the Eastern Cape. And of course, those are the areas where a lot of our indigenous people live up near Durban. But here in Cape Town, we've suffered probably the worst of the pandemic at this time, because we're highly, very high tourist area, mostly people out of Europe. So that probably plays a lot of part of the infection level. One of the things that we're having just a concern about ourselves, Betty and I, we've been in lockdown now for 95 days and have been outside, if I were to just make a rough number, 5 days, approximately 3 or 4 hours a day. One of our concerns is, what are we probably facing when we do come out of this lockdown after having been isolated like this? Anyone have any thoughts about that?
Dr. Staver? Well, one, I think you do need to maintain your physical activity. That must be maintained even though you're locked down, even if it means marching in place at home, walking up and down any steps available to you. You want to do that. I don't know that there would be any acute change in your immune status, but we have suggested in the past that you take micronutrients. I told people that I take prenatal vitamins. I take vitamin C, 2,000 milligrams a day, vitamin D, 50,000 units per week. And I try to, I'm on mostly a plant-based diet. Every now and then somebody brings in a corned beef thing and I can't resist that. But basically I try to stay on a plant-based diet to boost my immune system. I also have been involved in regenerative medicine. So occasionally I've taken something called exosomes, which is the RNA derivative of stem cells, in an effort to keep my immune system up. I do follow my own rules of social distancing. I still continue to practice medicine, but my doors in my office are locked. You come in after you knock. We ask you questions about exposure. Then you come in, we spray your hands with 70% alcohol. We put a thermometer in your ear, and if you pass all those tests, we allow you in. We social distance at least 6 to 9 feet. We put you in the room. And I never thought I'd be practicing medicine without touching people. But I
Yeah.
take a very good history, and I have an ear that can be a stethoscope from 6 feet away. But we're doing a lot of telemedicine. So I think what we're asking people to use is good common sense. I do think that there is community spread. I believe that this virus can be aerosolized. I think that even the 6 feet is a pipe dream. I think the spacing should be much more, but that's what's out there now. So at least use that. But if you can make it 9 feet or better, well, and also realize that when people breathe in and out, many of you come from colder climates and you can see your breath in the air. I believe that breath contains or has the ability to contain aerosolized virus. So be careful about when you're following people on the sidewalk or in a building that you don't walk through their breath cloud. Those are some of my thoughts.
Well, I think you, Randall, I think you'll be glad to hear what we've done is hired a personal trainer that works with us over Zoom 3 or 4 times a week.
Twice a week.
Twice a week, yes, twice a week. So that's keeping us pretty well physically fit. Our basic interest, though, is we do have to go out periodically on some business. And of course, having been in lockdown now for 91 days or more, we're just concerned about how our immune system will work just in general with other things that we may come into contact with. We've got to go over to the U.S. Embassy next week. There, of course, we'll probably bump into a lot of people from around the world that are involved here in Cape Town with U.S. issues, related issues. But we'll do the best we can to keep ourselves masked and so forth. So, but so far, so good.
Good. I have to say, as a point of personal observation, I went to an anniversary celebration of Betty and Hal a couple of years ago, and they have a STEM center. It was in Inglewood at the time, and they both walk in. They're both over 6'2" tall. They came in an African garb, and I won't tell your age. Hal is old. Betty's only in her 20s, but the two of them walked in, and it was the most beautiful sight of two royal African king and queen coming in. So proud of them. And Betty, you look good to be 28 years old.
I like that. I want to add that we do get air because we are blessed to have a balcony about a mile from the ocean, from the Atlantic Ocean. So we can sit out on the balcony, get air, get sunshine, get natural vitamin D, and do a couple of walks back and forth across the balcony in addition to the trainer. So.
Okay, very good. We're close to the end of our call. I want to make sure that we maintain some of our informality. If there are any brief questions, either in the chat box or from individuals on the call that they would care to ask. But I don't want to open the floor for long statements. Michelle, do you see anybody that has their hand up?
I don't see any hands up. I was going to give a pause just to see if anybody wanted to jump in before I read the few last comments in the chat box. Anybody want to contribute anything?
Hi, this is Lamar, pharmacist from Los Angeles. Just wanted to offer an endorsement to the Scripps Center instruction. It's very thorough and very, very, very informative. And it's an eye-opener for those of us that haven't taken a look to maybe the mother of medicine, that is, in fact, the plants that originally pharmacy was most of the medicine, not all at first, long before we had NMR, came from plants. So please think about, at least look at that Scripps program. Thanks.
What's the reference on that, Dr. Lamont Gibson?
That was on the integrative information, evidence-based information on supplementation and integrative medicine.
Okay. Is Dr. Roger Mitchell? Is Dr. Okay. Michelle, anything else to read on there?
To clarify, the Scripps Center, is that SCRIPPS?
Yes.
Okay.
Dr. Saber, do you have a closing statement? Are you still on?
She had to leave. Yeah, she had to leave. So I was going to read the last three statements here or comments. One was, if you trust.
If I could, Michelle, I can't recall.
Sure.
Did we introduce the new assistant?
Corey?
Yes.
We mentioned her. We did not formally introduce her in this call yet.
We may want to, given the work that she's done to date and the very quick ramp up that she's taken on.
Corey, are you here? We'll give her a minute if she's online. I don't see her personally, but Corey, jump in anytime if you are here. I'm going to move forward with these statements real quick. Hopefully she's maybe just stepped away.
Okay.
There was a comment. If you trust the CDC, this is with respect to vaccinations. If you trust the CDC, yes, you will believe that vaccines are efficacious. I think that's the word. Mm-hmm. Look up Dr. William Thompson and autism. And then there was another statement that says, I thought the issue was the increased number of vaccines compared to when we were coming up, and big pharma's push to make money from vaccinations. And then the last is, where are the double-blinded placebo-controlled studies comparing vaccines to no vaccines? You will not find any, except one in Denmark. Doctors are not even trained about vaccines, how they work, and what is in them. The CDC and the NIH are funded by pharmaceutical companies, and yet you trust what they tell you.
Let me comment. First of all, you look at the country and the world that we live in. We know that there are issues of capitalism and countries founded on making money. Most of us do know about big pharma and the fact that we pay for drugs at 10 times or more the price that any place else in the world pays. We know that we also have the best safety of drugs any place in the world. I've worked in Africa. I worked in the South Pacific and Asia. And the one thing I've always prayed for, don't let me get sick in any of those places. Whatever issues I may have with health disparities, racism, or whatever, here in my country, if I'm sick, I want to be here. On the issue of vaccines, most of us do have training on vaccines. If you're on a respirator, if you're in critical condition, most people aren't worried at that point in time about whether the trial was double blind, whether there was a 95% trial agreement on the outcomes. You just want to save your life. Any physician worth his salt understands that there are some issues and questions about vaccine. But at the moment, we do know that the survival of our children and of our species, especially in the Western world, has depended pretty much on the development of vaccines. So you have to take everything in context with what they are. We will present a program in coming weeks, and debate this process with recognized experts who will have access to information. Now, on another group that we have, which we call the Select Roundtable, we have gathered a group of subject experts who are both healthcare, medicine, Department of Defense, former Assistant Secretaries of Health, general officers of the military, all Black, to internally debate some of these issues of who to trust, which is how this call grew out, that we can present the most credible information that we can at this point in time. We also are trying to develop our own sources of credible, raw information, analyzed to present. And even information from the CDC, we don't just take it as from the Bible, we take it and analyze it. Sometimes we agree with it, sometimes we don't. But we do try to present information as we see it. It's not a matter of do you trust the CDC? I don't trust anybody. But you have to have a starting point. We also have created, so you'll know, an organization that is going to give medical second opinions. There's already a white organization called Second Opinion Expert. We're going to use a proprietary software that we're purchasing from them, but with our physicians and our healthcare professionals, that will allow us to summarize charts, medical information, and provide our view of what that second opinion should be for those of you who want to contract with us. So you have to start someplace. You know, it occurred to me, I may want to look at TV, I may want to look at the radio, but I don't have to go back and build that radio or that TV from scratch. We have a platform that we can build upon, and over time, it will become more and more accurate. So vaccines are here. I believe that they play a part. I do agree that they have to be vetted. We've even set up a subcommittee, and one of the leaders of that is Dr. Lamont Gibson, who's a PharmD, to find a way to evaluate the companies that are making some of these vaccines so we can bring that information to you. That takes time. But regardless of how bad our system may be in some eyes, right now, the healthcare system here, would you rather be here with the medicine and the physicians that we have, or in some place where they have no medicine, they have no expertise at the level, but we do know that we have to protect ourselves, especially if you go to places like Cedars and other places where they may not care about you or want you there. It's the relationship that you have with your physician that makes a place safe. And that's why I advise people when and if they go to the hospital with their family, that someone who cares about them ought to be with them as much as possible. So we have to make the best of what we have until we are able to be more in control of what goes down there. I had to go to the hospital a year ago. My wife went with me, my kids went with me, and they looked at everything they were sticking in my arm and questioned everybody. That's common sense, that's how you need to protect yourself. The Black Health Trust hopes to offer you physicians that care about you, that are family with you, to give you credible advice. Not over the physician that you have, but in addition to what you have. It is very important that we do realize that there has been systemic racism in our society, and we have been the victim in many cases of people who don't care or who neglect us. But to the best of our ability, we're trying to correct something. Some 50 years ago, Dr. Williams, who's on the screen, wrote a book, the first one on Black-related diseases. That was an important factor. Over the years, he's written 8 more books concerning issues of how we treat our patients. I was able to co-author a paper some years ago in the NMA Journal about the genetic basis of medicine, precise medicine. We may be made all alike under the eyes of God, but there are specific enzymatic, hormonal, blood type differences in us, and we have to be able to ferret those out. There are also cultural differences. For example, I used to always wear in my office when I'm seeing Little Miss Jones, Sally Smith. Until recently, I've always worn a tie because I wanted to make sure they knew that I respected them. I never called a patient Miss Lulu. I called them Mrs. Jones, Mrs. Smith, because respect is what our patients deserve. But to say that we should throw out everything that we've accomplished in this country and say it's no good, that's BS. Doesn't make any sense at all. So we evaluate what's good and we use it. We throw out what's bad and we don't use it. But at least you can trust the physician that we bring to this call and the documents that we're going to be writing in the future to have given their best thought on how to take care of our broader family. I would invite my mentor to comment on that for a minute. Dr. Williams, you're recognized.
Thank you, Dr. Massey. Excellent closing statement. I just want to bring up again an issue about vaccines and try to make a very specific, brief point with one disease, and this is a matter of fact and proof, and the disease is smallpox. Dr. Stavern mentioned it before. Our memory is somewhat short in regards to things that happened to us. It was only relatively short period ago, in 1918, when we had the so-called Spanish flu that descended upon us. And that Spanish flu, so-called, killed 1/3 of the population of the world. Now, that's a horrible situation, which we hope we can prevent from being repeated with COVID-19. At that time, we didn't have vaccines that were used. Since that time, several have been developed for important diseases. The one disease that I want to call to your attention is smallpox. I mentioned it before. Whether you recall it or not, over the course of history, smallpox was responsible for killing 500 million people, 500 million people in the world. It's the biggest of all time. And now it has been eliminated from the face of the earth. How? By the employment of vaccination. You all recall being vaccinated when you were in school, that scarification on your shoulder or somewhere. That's what rid of smallpox. And at that time, you didn't have a choice. You were forced to take that vaccination or you weren't going to go to school. Now we've given people rights to refuse it. And unless we have herd immunity, we're going to see diseases like COVID-19 persist, even if we have vaccination. We have to be sensible, as Dr. Maxey mentioned, and not allow the crap to be instituted in our system of medical care. We have to be smart enough to recognize that there are things that sure have some safety concerns, but you don't throw the baby out with the bathwater. You make sure that you keep the things that are good, such as the excellent aspects of vaccination, while you safeguard against the dangers. So I want to make sure that everybody recognizes that vaccination is certainly a serious consideration, but that you don't make the mistake of saying because of some limited safety concerns that we shouldn't vaccinate people. Thanks very much.
Thank you, Dr. Williams. In 2 weeks, we're going to have on the 19th of July, we will have on the call Deputy Police Chief Regina Scott of the LAPD to make a presentation and to answer questions. We also hope to have Congressman Val Demings, who is a former police chief in
Orlando,
in Florida. And
Orlando.
yes, and we've invited Congresswoman Karen Bass, who is actually a physician's assistant in a former life, who is chairman of the Congressional Black Caucus. So it is important in a matter of health, what's going on with all of these shootings and beatings that the police do, that is also a part of health. We also have a number of other physicians, Dr. Natalie Carroll, who is a practitioner of OBGYN in Houston, who's been taking care of COVID-19 pregnancies. And we want to bring that topic to fore. So we've got some exciting days ahead. We're at the end of our call. If Bishop Pate is on, I wanted him to take us out in prayer. If not, I know Brenda Lee Ager is here, and she has served our cause very much. Brenda, are you available to take us out in prayer? Being there are no other urgent conversations or comments that somebody wants to make briefly?
I'm here.
Before we close?
I'm here, so let's just take a deep breath, one long breath. The breath is life. Father, Mother God, how great thou art. How infinite and how wonderful you are. And how great to know that we're made in the image and likeness of this great, great presence that we call God. It is everywhere we are. It is right where we are right now. So we call upon that presence and thanksgiving. I give thanks before I even ask, to know that we're surrounded by the love of God, and all that this meeting and this wonderful, wonderful organization that is springing up to be a beneficial presence on this planet to all people near and far, and to our wonderful communities. We're surrounded and immersed in the love and the light of God. And we thank you. We thank you for all that is happening on this planet. What it looks like may not be what it's going to be, but we know that it's only a valley and we work toward the higher ground. I give thanks for Dr. Maxey, and I give thanks for everyone on this call, all the people. And I want to give thanks for Dr. Richard Williams as we hold him in our hearts, in our prayers, in our love, and knowing that surrounded by all the angels, especially one beautiful angel. So I give thanks for everyone to have a wonderful week. We'll see each other next week. And I just give thanks as I release this prayer to the universal, knowing that it is already done. I bless this day and this whole week and say, thank you, God. Thank you, God. Thank you, sweet spirit. And so it is. And so I let it be. Amen and amen and amen. Blessing our niece, Tommy, have to do that, knowing that right where she is, God is. And it's working it out. Thank you, God. Amen.
Amen. Have a good Sunday, everybody. Thank you.
On behalf of Black Health Trust, thank you. Have a great week.
Have a great week, Michelle.
Peace and blessings, a supreme protection, family.
Yes.
Take care of yourself. Eat to live, don't live to eat.
Amen.
Exactly. Amen. Thank you for that prayer, Brenda.
It's my pleasure. Take care, Richard.
Okay. Everyone have a good week. Martin.
Everyone have a good week from Philadelphia, Pennsylvania. Hi, Martin. Thank you for all that you do, Dr. Maxey.
Thank you.
Thank you for the beautiful prayer. God bless from Cape Town.
Love you guys, Hal and Betty. Love you guys.
Love you
Hi,
too, man.
Helen.
Take care.
Hi,
God
Betty.
bless.
Hi,
Bye-bye.
sweetheart. Hi, my little nephew.
Betty,
Yes.
this is Tori. How are you?
Oh, blessed by the best. How about yourself?
I'm glad. Give Merle a call if you can.